What if everything you thought you knew about Michael Jackson's death was a lie? For over 15 years, the world has been fed sensational headlines, wild conspiracy theories, and media speculation about what really happened to the king of pop. But today, we're cutting through the noise. We're diving into the official autopsy report, the actual medical evidence, and separating the documented facts from the rumors that have haunted Michael Jackson's legacy since June 25, 2009. The day Michael Jackson died, the world stopped. News channels went into overdrive. Social media exploded, and within hours, the rumors began. Some said he was already dead for hours before anyone found him. Others claimed his body was covered in needle marks from decades of drug abuse. Tabloids reported he weighed only 90 pounds, that he was practically bald, that his body was so damaged by cosmetic surgery that he was unrecognizable. The stories got more bizarre by the day. Some even suggested he faked his own death. But here is what most people do know. The Los Angeles County coroner completed a comprehensive autopsy report, and the findings tell a very different story than what the media sold us. This wasn't just a routine examination. It was one of the most scrutinized medical investigations in modern history, conducted by experienced forensic pathologists who had no reason to lie or cover anything up. Every organ was examined. Every mark on his body was documented. Toxicology tests were run multiple times to ensure accuracy. So why do the rumors persist? Why do millions of people still believe things about Michael Jackson's death that simply aren't true? The answer is complicated, but it starts with understanding how media sensationalism works. When a global icon dies unexpectedly, there's an insatiable appetite for information. And in that vacuum, rumors spread faster than facts. Headlines that shock get more clicks than headlines that inform. A story about a bizarre medical condition is more shareable than the truth about prescription medication misuse. But the consequences of these rumors go beyond just tabloid gossip. They've distorted public understanding of what actually killed Michael Jackson. Let's start with the basics. The official cause of death. According to the Los Angeles County Coroner's Office, Michael Jackson died from acute propofol intoxication combined with the effects of benzodiazepines. The manner of death was ruled a homicide, meaning it resulted from the actions of another person, in this case, Dr. Conrad Murray, who was later convicted of involuntary manslaughter. Now, what exactly is propofol? This is crucial to understanding what happened. Propofol is a powerful anesthetic used in hospitals for surgery and medical procedures. It's administered intravenously and works extremely fast, inducing unconsciousness within seconds. It's so potent that it requires constant monitoring by trained anesthesiologists with equipment to support breathing if necessary. Propofol is never, and I mean never, supposed to be used as a sleep aid in a home setting. Yet Dr. Murray admitted to giving Michael Jackson propofol regularly to help him sleep, a practice that medical experts unanimously condemned as reckless and grossly negligent. The autopsy revealed that on the morning of June 25, 2009, Michael Jackson had lethal levels of propofol in his system, along with sedatives, including lorazepam and midazolam. This combination essentially shut down his respiratory system. He stopped breathing. His heart stopped. And despite attempts at CPR and emergency medical intervention, he was pronounced dead at Ronald Reagan UCLA Medical Center at 2:26 p.m. Now let's address the first major rumor, that Michael Jackson was emaciated, weighing barely 90 pounds and on the verge of starvation. The autopsy report states clearly that Michael Jackson weighed 136 pounds and was 5 feet 9 inches tall, giving him a body mass index of approximately 20.1, which falls within the normal healthy range. Yes, he was slim, but he was not dangerously underweight. The medical examiners found no evidence of malnutrition or eating disorders. His organs, aside from some issues we'll discuss, were generally of normal size and appearance for someone his age. The media made a spectacle of his weight, publishing articles claiming he was wasting away, too weak to perform, surviving on nothing but pills and energy drinks. These stories painted a picture of a man on death's door, but the medical evidence doesn't support this narrative. Was it then? Yes. Was he in the physical condition you'd expect from someone preparing for a demanding concert series? That's debatable. But was he starving to death? Absolutely not. Multiple medical experts who reviewed the autopsy confirmed that Jackson was within acceptable weight parameters for his height and frame. Another persistent rumor involves his hair. Tabloids claimed Michael Jackson was nearly bald, wearing wigs for years to cover extensive hair loss. The autopsy did note that Jackson had frontal hair loss, directly related to scarring from a Pepsi commercial accident, where his scalp was severely burned by pyro. However, he wasn't completely bald. He had short hair, and yes, he did use wigs and hairpieces for performances and public appearances. But this isn't the shocking revelation the media made it out to be. Many performers use hairpieces. The burn injury from 1984 was well documented and left permanent scarring on his scalp, which is entirely consistent with the autopsy findings. Let's talk about the plastic surgery rumors next. The media narrative suggested Michael Jackson had so much cosmetic surgery that his face was falling apart, that his nose was prosthetic, that he was held together with surgical tape and makeup. The autopsy findings are far less dramatic. Yes, there was evidence of cosmetic procedures. The medical examiners noted that his nose showed signs of previous rhinoplasty surgeries, and there was a prosthetic implant in the nasal tip area. But his face wasn't collapsing. There was no evidence of the catastrophic surgical complications that tabloids love to speculate about. It's important to understand that while Michael Jackson clearly had multiple cosmetic procedures over his lifetime, the autopsy didn't reveal anything medically alarming in terms of surgical complications at the time of his death. Was there evidence of past surgeries? Yes. Was his body destroyed by them, as some reports claimed? No. The sensationalized descriptions of his appearance were designed to shock readers, not inform them. The autopsy also addressed his skin condition. Michael Jackson had vitiligo, a well-documented skin disorder that causes loss of pigmentation. This wasn't a rumor, it was confirmed by the medical examination. The report noted patches of light and dark skin consistent with vitiligo, and microscopic examination revealed reduced melanocytes, the cells responsible for skin pigmentation. For years, Jackson was accused of bleaching his skin because he didn't want to be black, a racist and cruel narrative that ignored his actual medical condition. The autopsy proved what his dermatologist Dr. Arnold Klein had stated for years. He had a legitimate autoimmune skin disease. Jackson had been diagnosed with vitiligo in 1986 and also had discoid lupus, diagnosed in 1983. Now let's dive deeper into the toxicology findings, because this is where the gap between medical facts and media rumors becomes most significant. The toxicology report revealed the presence of multiple substances in Michael Jackson's system at the time of death. But understanding what these were and what they mean requires context that the media rarely provided. First, the propofol. The blood concentration of propofol found in Michael Jackson's system was 2.5 micrograms per milliliter in femoral blood, with significantly higher concentrations in other tissues, 22 micrograms per gram in the liver, 3.6 micrograms per gram in the kidney, and 11.3 micrograms per gram in brain tissue. Medical experts testified that these levels were consistent with general anesthesia, the kind of deep unconsciousness required for major surgery. In a hospital setting with proper monitoring and respiratory support, this might be manageable. In a bedroom with inadequate equipment and a doctor who left the room, it was fatal. The autopsy also detected lorazepam. Now, the media seized on this list of drugs to paint Michael Jackson as a hopeless addict who brought his death upon himself. But let's look at the actual medical context. Lorazepam and midazolam are benzodiazepines, often used for anxiety and sedation. Dr. Murray admitted to administering these along with propofol as part of his misguided attempt to help Jackson sleep. Diazepam is another benzodiazepine, similar in function. Lidocaine is a local anesthetic that Dr. Murray claimed he mixed with propofol to reduce injection site pain. Ephedrine is sometimes used to treat low blood pressure. None of these substances, except the propofol, were at particularly alarming levels individually. The danger came from the combination, especially mixing central nervous system depressants like propofol with benzodiazepines, which together can severely suppress breathing. This wasn't recreational drug abuse in the traditional sense. This was a doctor administering dangerous medications inappropriately. But here is what is crucial. The autopsy found no evidence of long-term organ damage, typically associated with chronic drug abuse. His liver appeared healthy, with no signs of cirrhosis or toxic damage. His kidneys were normal. His heart showed good strength with no significant plaque buildup in the coronary arteries. though there was some mild arteriolosclerosis. For someone portrayed by the media as a decades-long drug addict, his organs were in remarkably good condition. Medical experts who reviewed the report stated that Jackson was fairly healthy for his age. The autopsy did note some health issues worth mentioning. There was inflammation in his lungs, chronic bronchitis, consistent with someone who had respiratory issues. His prostate showed mild inflammation. There were multiple puncture marks on his body where injections had been administered, consistent with the medical treatments he was receiving. But nothing in the internal examination suggested a body ravaged by addiction in the way the media narrative suggested. One of the most damaging rumors was that Michael Jackson had been doctor shopping for years, collecting prescriptions from multiple physicians to feed an out-of-control addiction. While it's true that Jackson had relationships with various doctors and struggled with pain management, particularly after injuries from performances and the 1984 burn incident, the autopsy, evidence doesn't support the image of someone with massive organ failure from drug abuse. What it does reveal is someone who is being treated by a physician who made catastrophically bad medical decisions. Let us address another rumor that circulated heavily, that Michael Jackson had been dead 4 hours before anyone called 911, and that there was a delay or cut. The timeline from the investigation shows that Dr. Murray discovered Jackson not breathing sometime around noon. The 911 call was placed at 12:21 p.m. Jackson was transported to UCLA Medical Center where he arrived at 1:14 p.m., and resuscitation efforts continued until he was pronounced dead at 2:26 p.m. While there were serious questions about why Dr. Murray delayed calling 911 and why he didn't immediately tell paramedics about the propofol, there is no evidence that Jackson had been dead for hours before help was summoned. The medical evidence and testimony from paramedics and hospital staff created a clear timeline of events that refutes this particular rumor. The autopsy also revealed evidence of vitiligo, beyond just the skin patches mentioned earlier. The condition was widespread across his body, affecting large areas of his skin. This helps explain why he wore heavy makeup and used depigmenting creams prescribed by his dermatologist. For someone in the public eye constantly photographed and scrutinized, having a progressive skin condition that created increasingly uneven skin tone would have been extraordinarily difficult to manage, especially in an era when vitiligo wasn't as widely understood or discussed as it is today. The tattoos discovered during autopsy also contradicted some media reports. Jackson had permanent makeup tattooed on his eyebrows, eyeliner, and lips, a fairly common cosmetic procedure called micropigmentation. Some reports sensationalized this as evidence of extreme vanity, but permanent makeup is used by many people, particularly performers who need to look camera-ready constantly. So where did all these rumors come from, and why did they spread so effectively? Understanding the machinery of media sensationalism helps explain how facts became distorted beyond recognition. When Michael Jackson died, there was an immediate global demand for information. Every news outlet, every website, every tabloid was competing for attention in an oversaturated media environment. In that competition, accuracy often took a backseat to speed and shock value. Anonymous sources became insiders with knowledge of the investigation. Speculation was presented as fact. Blurry photos were analyzed by people with no medical expertise, making wild claims. And because Michael Jackson had been a tabloid fixture for decades, there was already an established narrative about him, the weird, reclusive, drug-addicted former star who had become a shadow of his former self. Confirmation bias meant that any rumor that fit this narrative was readily believed and shared, while facts that contradicted it were ignored or downplayed. Social media accelerated this process exponentially. Rumors that might have once been confined to supermarket tabloids now spread globally within hours. People shared sensational headlines without reading the actual articles. Conspiracy theories found fertile ground in online communities. And once false information is out there, it's incredibly difficult to correct. Studies show that corrections rarely reach as many people as the original false story, and many people who see corrections still retain the misinformation. The medical and legal proceedings that followed Michael Jackson's death did eventually establish the facts, but by then, the rumors had already become entrenched in public consciousness. Dr. Conrad Murray's trial in 2011 put much of the medical evidence on public record. Expert witnesses explained what propofol does, how it should be used, and how grossly Dr. Murray violated medical standards. The prosecution built a detailed case showing that Jackson's death was preventable and resulted directly from medical negligence. Dr. Murray was convicted of involuntary manslaughter on November 7, 2011, and was sentenced to 4 years in prison on November 29, 2011. However, he served less than 2 years due to California's prison overcrowding policies and credit for good behavior. He was released on October 28, 2013, a sentence many felt was insufficient given the severity of his negligence. The trial revealed that Dr. Murray had been hired to help Jackson prepare for his This Is It concert series, that he was being paid $150,000 per month, and that he had agreed to give Jackson propofol nightly despite the obvious dangers. Phone records showed Dr. Murray was on the phone when he should have been monitoring his patient. He delayed calling 911, failed to properly perform CPR, and did not immediately disclose to emergency responders what drugs he had administered. All critical failures that likely cost Michael Jackson his life. But beyond the criminal case, there are broader questions raised by Michael Jackson's death about medical ethics, the responsibility of physicians, and the dangers of prescription drug misuse. Michael Jackson was wealthy and famous enough to find a doctor willing to do something that no ethical physician should ever do. This was UNS street drugs, or illegal substances. This was a licensed physician bringing hospital-grade anesthesia into a home and using it inappropriately. The power dynamic between celebrity patients and doctors who become financially dependent on them creates dangerous situations where medical judgment can be compromised. The autopsy evidence also forces us to confront how we talk about addiction and pain management. Michael Jackson clearly struggled with pain, particularly related to performance injuries and the 1984 burn that caused lasting damage to his scalp. He had legitimate medical needs for pain relief, but the line between appropriate pain management and dangerous dependency is not always clear. And when patients have unlimited resources to seek out physicians willing to prescribe whatever they want, the results can be tragic. What the autopsy definitively shows is that Michael Jackson did not die from the lifetime of supposed drug abuse and physical deterioration that the media narrative suggested. He died from acute drug intoxication on a specific day, administered by a specific person, in circumstances that were preventable. His organs were largely healthy. His body, while showing signs of past medical procedures and legitimate medical conditions like vitiligo and lupus, was not in catastrophic decline. He was preparing for a demanding 50-concert series in London, which suggests he retained significant physical capability. The real tragedy is that Michael Jackson's death was unnecessary. With proper medical care, appropriate boundaries, and ethical physician behavior, he might still be alive today. The autopsy evidence supports what prosecutors argued in Dr. Murray's trial. This was a preventable death caused by gross negligence. 16 years after his death, it's time we let the actual evidence speak louder than the rumors. Michael Jackson was a complicated person with well-documented struggles, but he deserves to have the truth told about how he died. The autopsy report isn't perfect. No medical document is, but it's based on scientific examination and forensic expertise, not tabloid speculation or social media theories. Understanding what really happened doesn't diminish the tragedy of his death. If anything, the truth makes it more tragic because it was so preventable. A 50-year-old man died because someone he trusted to provide medical care instead provided reckless and dangerous treatment. That's the real story the autopsy tells. So, now you know the truth. The actual medical evidence, the real autopsy findings, and the facts that got buried under years of sensational headlines and internet rumors. Michael Jackson's death wasn't the bizarre mystery the media wanted it to be. It was a preventable tragedy caused by medical negligence. But here's what I want to know from you. Were you surprised by what the autopsy actually revealed? Did any of these facts contradict what you thought you knew about Michael Jackson's death? And more importantly, why do you think these rumors spread so far and lasted so long despite the evidence? Drop your thoughts in the comments below. I read every single one, and I'm genuinely curious to hear your perspective on this. If you found this video valuable, if it changed your understanding or taught you something new, do me a favor and hit that subscribe button. We're building a community here that values facts over sensationalism, evidence over rumors, and respectful investigation over tabloid gossip. There are so many stories, like this cases, where the public narrative doesn't match the actual evidence, and we are going to keep exploring them together. And before you go, hit that like button. If you appreciate the research that went into this video, it helps the algorithm show this content to more people who are searching for truth instead of clickbait. Share this with anyone who still believes the rumors about Michael Jackson's death. Let's replace misinformation with facts, one share at a time. Thanks for watching, and I'll see you in the next one.